Many people have the habit of walking barefoot on the floor without realizing that potential dangers may be present in every step. Every day, your feet touch the floor hundreds of times. However, not every contact is harmless. Some injuries begin very silently, and by the time you notice pain, fatigue, or numbness, your feet may have already been affected for a long time. So, why should a seemingly normal habit, such as walking barefoot indoors, be given attention? 1. The habit of walking barefoot indoors. Many people like walking barefoot at home because it feels comfortable. After many hours of being confined in shoes, socks, high heels, or office footwear, the feet often need to relax. When shoes are removed, the toes can spread more freely, the skin of the feet becomes more ventilated, and the body feels lighter. Some people choose to walk barefoot on carpets, wooden floors, or floors with heating systems. In summer, walking barefoot also creates a cooling sensation. In winter, many homes have heated floors, making barefoot walking indoors feel even more pleasant. However, problems begin to appear when we walk barefoot for too long, walk on surfaces that are too hard, cold, or slippery, or when the feet already have underlying problems that we have not yet recognized. The initial comfort may sometimes cause many people to overlook the body's small warning signs. In other words, walking barefoot indoors is not a habit that must be absolutely prohibited. However, if it is done every day, for many hours, on unsuitable surfaces, it can place considerable stress on the feet. 2. Signs that the feet are being affected. One common sign is heel pain, especially when getting out of bed and placing the feet on the floor. The pain may decrease after walking for a while, but it can easily return after standing for a long time or moving around a lot. Another sign is a feeling of fatigue, tightness, or aching in the sole of the foot. At first, this sensation is often mild, so many people ignore it. However, if it repeatedly occurs after cooking, cleaning, doing housework, or walking frequently on hard floors, it may indicate that the feet are under excessive pressure. The skin of the feet may begin to become dry, cracked, thickened with calluses, or painful when touching the floor. These changes often appear on the heels, the edges of the feet, or areas that bear significant weight. This is the skin's response to repeated contact and pressure. In addition, numbness, tingling, burning, or reduced sensation in the feet should not be taken lightly, especially in people with diabetes, poor blood circulation, or peripheral neuropathy. These symptoms may prevent them from recognizing small wounds on the feet. 3. The effects of maintaining this habit long-term. The most common effects are heel pain and pain in the sole of the foot. When the feet come into direct contact with hard flooring, the soft tissues in the heel and sole must absorb more force. If this condition persists, the plantar fascia may become strained, irritated, or inflamed. The pain is often more noticeable in the morning, after standing up from prolonged sitting, or after a day of standing for long periods. The second effect is increased pressure on the joints. The feet function as the body's natural shock absorbers. Without cushioning or support from slippers, force from the floor may affect the ankles, knees, hips, and back. In healthy individuals, this effect may not be obvious. However, in older adults, people who are overweight, pregnant women, people with joint pain, or those with abnormal gait patterns, prolonged barefoot walking may worsen discomfort. The third effect is an increased risk of minor injuries. Even indoors, there may still be pieces of glass, staples, toys, wood splinters, furniture edges, or slippery bathroom floors. A small cut in a healthy person is often a simple matter. However, in people with diabetes, poor blood circulation, or reduced sensation in the feet, a small wound may heal poorly and be more prone to infection. The fourth effect is changes in the skin of the feet. The skin may become drier, the heels may crack more easily, and weight-bearing areas may develop thicker calluses. Winter makes the skin even more prone to dryness, and walking on heated or cold floors may cause the heels to crack more severely. Deep heel fissures not only cause pain, but may also become an entry point for bacteria. The fifth effect is the risk of falling. Tile floors, polished wooden floors, stairs, bathrooms, or kitchen areas with water and grease may all be slippery. Walking barefoot does not always provide better grip on the floor. If the soles of the feet are moist, the floor is wet, or balance reflexes are poor, the risk of slipping and falling increases. 4. Who should limit walking barefoot indoors? The first group is people with diabetes. Long-standing diabetes can cause peripheral nerve damage, reducing sensation in the feet. When the ability to feel pain, heat, cold, or pressure is reduced, patients may not realize that they have been scratched, mildly burned, blistered, or have stepped on a sharp object. If the wound is not detected early, the risk of infection and complications increases. The second group is people who often experience numbness in the feet or have poor blood circulation. When blood flow is poor, the tissue's ability to recover is also reduced. A small injury may take longer than usual to heal. If reduced sensation is also present, the person is even more likely to overlook the wound. The third group is older adults. As age increases, the skin becomes thinner, muscles become weaker, balance decreases, and the risk of falling becomes higher. Walking barefoot on slippery floors, cold floors, or stairs may be unsafe. Fit the feet properly and not be overly soft or unstable. The fourth group is people who currently have heel pain, plantar fasciitis, flat feet, high arches, or a history of ankle injury. These individuals often need better support from footwear. Walking barefoot for too long on hard surfaces may prolong or trigger recurrent pain. The fifth group is pregnant women, people who are overweight, or those who have to stand for long periods at home. When body weight increases or standing time is prolonged, pressure on the feet also increases. A pair of cushioned, non-slip indoor slippers can help significantly reduce the load. 5. How to protect your feet every day. The first step is to choose the right circumstances for walking barefoot. If the floor is clean, dry, not slippery, not too cold, and you do not have any foot disorders, walking barefoot for a short period is generally acceptable. However, when entering the kitchen, bathroom, balcony, basement, garage, or stairs, slippers should be worn. Second, choose appropriate indoor slippers. Slippers should fit the feet, not be too wide or too loose, have non-slip soles, and provide a moderate level of cushioning. Slippers that are too soft, too thin, or do not hold the feet properly may cause the feet to slide back and forth while walking. For people with heel pain or pain in the sole of the foot, slippers with better arch support should be chosen. Third, check your feet every day. Look at the heels, soles, spaces between the toes, and toenails. People with diabetes should consider foot inspection a daily habit. Fourth, keep the feet clean and dry. Wash the feet with warm water. Avoid water that is too hot, and dry them thoroughly, especially between the toes. If the heel skin is dry, moisturizer may be applied to the heels and soles, but too much should not be applied between the toes because moist areas can create favorable conditions for fungal growth. Fifth, keep the floor safe. Remove small objects, wipe up water, secure slippery rugs. In countries with cold winters, attention should be paid to cold floors and slippery socks. In conclusion, walking barefoot indoors can provide comfort and help the feet relax if done for a short period on clean, dry, and safe surfaces. However, this habit should not be considered harmless in all situations. When done too frequently on hard or slippery surfaces, or when the feet already show signs of pain, numbness, cracked skin, or injury, it may affect walking and daily activities. The feet are the foundation of the body. Listen to the signs from your feet, wear slippers when needed, and care for your feet regularly to help prevent unnecessary problems. I'm Monica Bellamy. Follow me to stay updated with useful health information.